Well, it's really good to be here. I want to thank the Senate President, Wilton Simpson, friend of mine, represents this area, as well as another friend of mine, Blaze Ingolia, and then Andy Fossa. Is Andy up here? He's been kicking butt. I mean, if you look at the number, you've done Sun City Center, you did Kings Point, yes, sir. You did Mainlands. That was fantastic. You're doing here. So this is really, really good. Well, I'm excited to be here. If you look at the statistics in terms of vaccinations of seniors, Florida's doing very well. At the same time, not every county is doing the same. Hernando County, as of earlier this week, was in the bottom 5 of percentages of seniors that have been vaccinated in the state of Florida. So we said we're going to do something about it. So I want to thank Blaze and Wilton for recommending that we come right here. And I think the High Point, I know they got a great 4th of July event that they do here. We wanted to make sure that we were getting vaccines in this community. And so this is a great site. We're going to have 2,250 vaccines over the next 3 days for seniors. 2/3 of that are High Point residents that the community has gotten together, and then the other 750 vaccines are we're done with in conjunction with Hernando County. So I think this is going to be really effective. I think what Andy has been doing, we did most of these senior communities in Broward and Palm Beach for the start of this, and then lately have been able to get into the west coast of Florida, and I think people have really appreciated it, and we're going to continue to do it. We're now well over 2 million seniors have gotten a shot in the state of Florida. Well over 75% of every single dose administered has gone to a senior citizen in the state of Florida. We're going to hit very soon. We probably have already hit it, but with the reporting delays, but we're going to be reporting fairly soon 50% of our massive 4.5 million senior population will have received a shot. And so this is really, really good progress. If you look at all the key metrics, number of shots for seniors, percentages of seniors vaccinated, percentage of doses that go to seniors, Florida is either leading or near the top of the country across the board. This will help Hernando County. This will help get those numbers up. We don't want to see them at 31 or 33%, wherever they're. That's actually not bad for the rest of the country if you look at it. But for Florida, when our state's going to be pushing 50% soon, we want to get Hernando up. So I think this will make a big impact. And again, these nearly 2,500 doses, this is all gravy in addition to what we're already doing. And in Hernando, you have the pharmacies, you have the county. I was in Miami yesterday, and we did the biggest pharmacy expansion in Dade County to date. We're going to have around the state, there'll be 81 pharmacies offering 100 vaccines a day. So all of the Navarro, CVS, EMOS stores in Miami-Dade County are going to be doing that. That's going to be huge for Miami-Dade. They're also sprinkled out some additional CVSs throughout the state. Not nearly the footprint that Walmart or Publix has yet for that, but if you want to look, go to CVS.com. I think here, I don't believe that they have one in Hernando yet. But we also have almost 600 Publix pharmacies, 119 Walmart and Sam's Club, 43 Winn-Dixie. So that's in 52 different counties you have retail pharmacies. In Hernando, we have 7 Publix pharmacies offering COVID-19 vaccinations. We have 1 Walmart pharmacy, and we have 1 Winn-Dixie pharmacy in Hernando County. So Publix window open again today, Publix.com/COVID vaccine. Walmart is Walmart.com /COVID vaccine. And then Winn-Dixie is Winn-Dixie.com /pharmacy /COVID vaccine. So keep looking for those. If you hadn't been able to get an appointment, I do think the demand is going to start to soften over the next week or two. As many of you know, we had 200 Moderna doses in many states as well that were delayed because of the winter storm. So you had them sitting, you couldn't get into the warehouses, there was snow, there was all this stuff. All that is now in the state, so that 200,000 from last week is here, as well as the 200,000 that we were expected to get on Tuesday anyways. So that's going to be good. That's going to help pharmacies. It's going to help the test sites. It's going to help our faith-based efforts. We're now close to 50,000 shots with houses of worship across 18 counties, predominantly African-American churches, but also including synagogues, mosques, as well as traditionally Catholic churches. We also have 87 permanent community vaccination sites, and those are open all week. So here in Hernando, the permanent site is at the Hernando County Fairgrounds. So they're doing over 3,000 a week, and if they can do more, you guys talk to me, I think we'd be able to do more with given the vaccines that are starting to come. This is one of our senior community vaccination efforts. As Andy said, we were in Mainlands in Pinellas Park on Friday, and I can tell you they were very happy to have that. I mean, they have a pretty active community there. They've been much less active since the dawn of COVID. A lot of folks wrote into us just saying how thankful they were to be able to hopefully start turning the page here and being more active. We also have partnered with FEMA to open 4 mass vaccination sites. So they'll be in Miami, Tampa, Orlando, and Jacksonville. So there's going to offer thousands of vaccines a day, and we're really excited about doing that. So with those federal sites, that's additional vaccine beyond what Florida had been allocated. So it's not coming out of what we had been getting or even any anticipated increases. That's purely a federal supply. And so obviously we're supportive of that because it's more vaccine. And the same thing with the pharmacy program. Now that we have CVS online, they're going to be doing those 100 doses a day. That's pharmacy doses from the federal government over and above what the state of Florida is getting. We do think we're going to continue to get increases in Pfizer. And so we had been getting 100,000, 110, 120,000 Pfizer. We're going to be over 200,000 Pfizer a week in terms of initial doses. If it's not this week, hopefully by next week. And I think that's going to go up more and more. So that's going to be helpful. And then we also have the approval of the Johnson & Johnson vaccine. You see there was an initial assessment by the FDA. It is safe and effective. And what I would tell people is, when you back up, the golf cart makes a noise. But what I would tell people on that is just understand, because the way it gets portrayed sometimes, I don't think is fair, and I don't think it's accurate. The Johnson & Johnson vaccine was found to be 100% effective at preventing death and virtually 100% effective at preventing hospitalization due to COVID. So that is a huge, huge win. Now, they will say it was 67% in terms of preventing all infection, but just understand most of those infections were mild cases, and even ones that were a little more serious didn't warrant admission into a hospital. So the Johnson & Johnson vaccine, it's going to be approved this week. They're going to start shipping it either this weekend or next week. I don't know how much we're going to get now. We're hearing conflicting reports, but we are going to use that. We're working on how exactly we're going to use it, because I'm mindful of if we set up a site or we add it to a site and people come, some people are fixated on Moderna, fixated on Pfizer, and we want people to make those choices. But I hope those choices understand that there's a lot to recommend from Johnson & Johnson. It's one dose. You take it once and you're done. And the clinical trials were very, very effective in terms of preventing hospitalization and mortality, which, look, yeah, no one wants to get infected with anything, but if you get infected and it's mild and you move on, that's a win, given that this is something that can obviously be more threatening to people. So I think the J&J is going to be really good. We're going to work to see exactly how we use it, but we are going to use it, and we're going to make that available for folks, perhaps in pharmacies, perhaps with doctors' offices. We're going through those right now. But Floridians, if all goes to plan, you should start seeing Johnson & Johnson sometime next week. That's the plan that they're going to do. Approve. They already have some produced, and then they're going to send some to the states, and we obviously are going to be ready, willing, and able to have that and put that into use. So I'm happy to be here. I think this is a really effective site that we'll have here over the next couple days, and I want to thank both Wilton and Blaze for helping us recommend and get this set up. So, Mr. President, you want to say a few things?
Yeah, thank you, Governor. And we really, from the very beginning of this crisis and COVID-19, this governor's been outstanding to take care of our most vulnerable. right? We initially shut down all access to the nursing homes. We made sure that they had the proper PPE to make sure that we were taking care of our citizens that could not do for themselves, that would be vulnerable to this disease, the most vulnerable. This is, being in Hernando County today, we really appreciate the governor being here highlighting the wins, and hopefully by the end of March, the vast majority of our senior citizens here in the state, 4.5 million, will have gotten the vaccine, but it's only because the governor's insistence on getting the vaccine to the most vulnerable. And so by the fact that we'll have all of our 65 and ups hopefully by the end of March with at least one shot in their arm is a major accomplishment and should not go overlooked, that only through leadership that's been able to happen. And so I look forward to continuing to support the governor as we continue to open the economy. We get more vaccines in arms, more supplies available, and we're looking forward to having a great session, Governor, and thank you for all your leadership.
Yeah. And before I bring Blaze in, I just think Wilton made a point about, so we have 4.5 million seniors. We know 100% are not going to opt for it, and that's fine. There's no mandate. It's there for you. We're going to work to make sure people who want it get it. And so you're going to have a certain amount that just aren't going to want it, and we understand that. I don't know how much that number is. We'll see as the demand starts to soften. But I will say, and I think something like this, what we've set up here, helps with this. There's some who, man, they will be on the website. They really want it. They'll travel. They'll do all that, and a lot of people will do that. There's others who they're not opposed to the vaccine, but, you know, they're not going to try to wait in line or do this or that. So if you bring it to a community and their neighbors are getting it, say, hey, just get in your golf cart and drive around, you actually get more people that will participate. And so I think it's good. We don't know exactly how many people in the senior community out of the 4.5 million are going to opt for it. I do know clearly we have multiple million who are very interested in it, and that's great. And there's probably some above that who are not opposed to it, but if you have things like this, I think are more willing to take it. Now, I do anticipate when you get into younger age groups, I do think the uptake is going to go down. I don't think you're going to see, in St. Johns County, that's my home county, we had 75% of seniors in St. Johns. Lafayette is close to 80%. Now it's a rural county. They have a small population. So those are really, really significant numbers. And so it wouldn't surprise me if St. Johns ends up hitting 85 or even 90%. I mean, that would be really, really good. How that's going to look, and you're talking about people eventually down the road in their 20s and 30s, I don't know. We're not mandating it for anybody. It's going to be a personal choice. But I do know in here with seniors, the more we can get it into their communities, I think the more buy-in that you get. Blaze?
Thank you, Governor. I want to thank the governor for coming to Hernando, showing not just the people of Hernando, the seniors of Hernando, but people all across this great state that this governor actually cares about what is going on. And I will stress the word leadership, because I think that is what you're getting out of this governor, nothing less. This governor is prioritizing vaccinations for seniors, and he's making sure that we are delivering that promise. Other states weren't doing that, and then now you see that other states are starting to follow this governor's lead. Governor, I want to thank you also for your leadership overall on this issue, making sure that we're not locking people down in this state. We're allowing people to earn a living, keep our economy going. I want to personally thank this governor for keeping our schools open, because that is important. So in short, while this is a serious issue, this pandemic, it is a tragic issue. One of the bright spots for me is the leadership of this governor, making sure that we are approaching this pandemic in ways that other states are not. So what other states are getting wrong, I believe that this governor is getting right. So thank you, Governor, for your leadership on this.
Okay. And, you know, one of the things I think that we're seeing with this, I mean, obviously I think in terms of health it's effective. Otherwise we wouldn't be trying to bring it to everybody. But, you know, I talked to folks, and there's some seniors who have been going on with their lives. You know, they haven't necessarily been cooped up the whole time. They know it's out there, they know it's real, but they're living. But even some of those would tell me getting the shot was a sense of relief. I mean, it did feel good to be able to get it, even though some of these folks had been very active. But it's kind of like you can move on to the next chapter, and we definitely saw that in Mainlands. I think a lot of those folks were really excited about it, and we're very excited as well. So we're going to keep doing it. I think that I think no state has done as much as Florida, one, in terms of prioritizing seniors, but the way we've had so many different options between state sites, county health, hospitals, retail pharmacies, working with the churches, doing our homebound program. We're over 1,300 homebound seniors that we've done. We've done a lot of World War II veterans. We've done a lot of Korean veterans. So we're proud of that. We're proud of being able to set up shop here in Hernando County. And if you have a Pasco site that you recommend, maybe we'll get that teed up too. If you're a senior and you haven't been able to get an appointment and you haven't gotten through, just hang in there, because there's going to be a lot of availability, I think, very soon. Every day we seem to get better news about J&J, about increased production from Pfizer. So I would just tell people, hang in there. We are not stopping on this, because we understand we've got 4.5 million seniors. Certainly 3 to 4 million are going to want this, and we want to be able to deliver it. And guess what? I think there's a lot of evidence out there, if you look at Israel, some of these other places that did a lot of early vaccinations, that this does make a big impact. You have fewer people hospitalized, and most importantly, it does save lives. And so that's what it's all about. Thanks, everybody.